supporting lactation and human milk feeding for queer and trans families. This is video 2 of the Strong Village, Strong Start series, a family-focused lactation support guide. Welcome to Supporting Lactation and Human Milk Feeding for Queer and Trans Families, creating an affirming and supportive environment. We honor and recognize both the power and limitation of language as it relates to our identities. We'll touch upon the lived experiences and needs of various queer identities, including but not limited to two-spirit, lesbian, gay, bisexual, transgender, intersex, and asexual individuals. It's important to acknowledge that terminologies do not encapsulate everyone's experiences. For example, two people who identify as gay may have different perspectives and experiences in their roles related to lactation. Throughout our discussion, we will refer to these communities collectively as queer and trans family, people, or partners. As we dive into our topic, let's maintain an open dialogue that embraces the diversity of experiences, ensuring that each voice is valued and heard in our exploration of how to provide effective, affirming support during lactation and human milk feeding. Human milk feeding is one of the most beneficial things for a baby's health, providing essential antibodies that help protect against infections and promote healthy growth. It also helps support the emotional and physical well-being of the lactating parent, but that can also feel intimidating as we can face challenges accessing human milk. For queer and trans families, this experience might include additional considerations like inducing lactation, navigating lactation after top surgery, or finding accessible and culturally appropriate support. Your role as a partner is critical in ensuring that the lactating parent feels confident and supported in these choices. Feeding on demand is crucial for building and maintaining milk supply. Babies often show subtle hunger cues, like sucking on their hands or rooting. Offering a feed at these signs helps make the feeding process smoother. Remember, crying is a late hunger cue. Human milk feeding is a skill learned by both the baby and the parent. Challenges such as soreness or difficulty with latching are normal but can be overcome with proper support from lactation experts and partners. Feeding your baby should not be painful. As a partner, being present during these moments of difficulty and offering reassurance makes a big difference in the success of feeding. Every family has different needs, and it's important to honor the feeding choices that best fit your family. In queer and trans families, these choices can range from inducing lactation to mixed feeding or exclusively providing human milk. For instance, if your partner has had top surgery and wants to use a supplemental feeding system to feed human milk or formula, they need your encouragement and support as they navigate this journey. If the decision is made to use donor milk or formula, it's essential to affirm and support that choice as well. We will now walk through 3 examples of queer and trans family formations and potential infant feeding options. A gay-identifying couple made up of 2 cis men might consider sourcing breast milk from a surrogate or looking into sites and applications for milk sharing information. Some families might also consider using a wearable nursing assistant for either or both of them to feed the baby, and they should also learn about paced bottle feeding. The labor of feeding the baby can then be shared by both partners. Please look to the resources slide to find more information about paced bottle feeding. Next, a lesbian-identifying couple made up of 2 cis women might consider co-nursing or shared breastfeeding. However, it is important to note that shared breastfeeding could cause low milk supply unless both partners are pumping or feeding every 2 hours, which of course is exhausting and time-consuming. Some families might also consider inducing lactation for the non-gestational parent to be able to breastfeed. They may also look into accessing donor milk and milk sharing sites. It is important that the non-breastfeeding parent also feel supported and invested in the human milk feeding process. As a third example, we consider a trans or non-binary identifying couple. This family's options may include, but are not limited to, lactating after top surgery and using donor milk or milk from a surrogate. It is especially important for this couple to feel respected and validated during their feeding journey as they navigate potentially harmful healthcare spaces and personnel. Trans and non-binary people might experience gender dysphoria and even violence due to their identities. As a support person, it is crucial to advocate for the lactating person in healthcare settings. Make sure to touch base beforehand and make a plan for any potentially uncomfortable or inappropriate questions regarding gender identity, pronouns, or sexuality, for example. Please look to the resources slide to find gender-affirming lactation support services. As a queer or trans partner, your role in advocating for the lactating parent is vital. This means helping to create a space where they feel comfortable providing milk, whether at home or in public, and advocating for their safety in healthcare settings. For trans or non-binary parents, there may be additional challenges like misgendering or lack of knowledge from healthcare providers. Your advocacy can help bridge those gaps by finding affirming care and being vocal when needed. You are also a part of the lactation team, offering emotional support, ensuring the lactating parent has time to rest, and helping with feeding routines are all ways to stay involved. This is about working together to make human milk feeding a success. Remember, as a primary support person, you need rest and care too. Cultural considerations are important too. In some Black or Indigenous queer and trans communities, there may be historical or systemic barriers to accessing lactation support. Understanding the root of these challenges and being equipped to address them as a partner is crucial. Lactation is a team effort, and as a partner, you can help build a system of support around your family. This might include finding lactation consultants who understand queer and trans identities or connecting with peer support groups. Check out the resource guide at the end of this presentation. Creating a daily routine that ensures the lactating parent has time for self-care, like showering or sleeping, is also essential. You can offer to help by feeding the baby expressed milk through paced bottle feeding, or by assisting with nighttime care, or giving baby a bath while your partner takes a shower, for example. Another potential support role is to be intentional about changing diapers after nighttime feedings. Seek out affirming healthcare providers and resources, and make sure the lactating parent has access to the support they need to succeed. This role can be filled by friends, family, other community members, and professionals. Thank you for joining us today for supporting lactation and human milk feeding for queer and trans families. Queer and trans partners play a vital role in the success of lactation and human milk feeding. Your support, advocacy, and involvement can make all the difference. By encouraging your partner, respecting their feeding choices, and helping to build a system of support, you're setting your family up for success. Together, we can make the feeding journey a positive and empowering experience for everyone involved. Here are some valuable resources to support lactation within the community. Be sure to check out and share www.breastfeeding.com.